And so let's just go through, if you could, some of the symptoms that you've had and what you've seen the changes with, the positive changes. And we're talking about this is positive news, right?
Right, correct. This is positive.
Yeah. So
in terms of positive improvement, for one, my wife's feet, her ankles were very swelled initially, but they started decreasing, started returning to normal. That was the first thing we saw within a week's time.
Within a week of taking the remedies.
Yeah, just taking the remedies, and in a week's time we saw a difference.
Amazing. And how much of a decrease do you think now compared to what it was prior to coming to me?
Oh, at least 80% increase of improvement.
Of 80% of a decrease of the swelling.
Correct.
Of the feet and ankles.
Yes.
Okay.
Yes.
So that's improved. She also had fasciculations in the thighs and the legs.
And that was our main driving force as to trying to find you and find a solution, because this fasciculation, which most ALS patients can understand, it's torture, not just as the patient but also as the caregiver, and the fasciculations, what it would do would just basically keep her from getting comfortable, from actually getting sleep. But after taking the protocol, man, in a matter of a few weeks, it's gone. Correct? Mm-hmm. I mean, it was basically to nothing.
Nothing. Hello, I'm Dr. Herman. I'm with Mr. and Mrs. Alvarez. We're here at my clinic in South Florida, and we'll get right to it here. So, your wife was diagnosed with ALS.
Yes, she was diagnosed with ALS back in March of this year. Mm-hmm. We initially started seeing symptoms way back in June of last year. Now, when this happened, it initially started with foot drop. So this kind of put a scare on us. So we wanted to go see various, medical doctors. So as far as ranging from podiatrists, help me out, neurologists, chiropractors, and
so a neurosurgeon too.
We did see a neurosurgeon, and seeing all these doctors, we just kind of felt like we were getting the runaround. Some of them prescribed certain medicines that weren't really effective. A lot of them were just passing us over to other doctors. So, it was a very defeating time for us. So this prompted my wife to go ahead and look for a solution. So we were looking for a holistic view. So we went online and we found you. And fortunately for us, you come highly acclaimed, and you're actually right down the street from us. Yeah. So we saved a lot on airfare.
Excellent.
At any event, we came by to see you back in May?
April of 2020.
April of 2020.
At the end of April.
That's right.
Toward the end. April 28th of 2020 was our first visit together.
That's right.
Before we get to that first visit, I'm sorry, and I appreciate it.
Sure.
And they're going to appreciate it. When you had gone the first route, you went through a podiatrist because of the foot drop.
That's right.
And then you also had an imaging study of the brain and the spinal cord.
That's correct.
And did they see any deterioration of the nervous system?
I want to say that their main thing was they were saying there was a lot of blockage along the spine, and there was actually the podiatrist had said that there was a cyst in the brain. Mm-hmm. that could have been the main issue as far as her losing control of her feet.
Right, but the podiatrist is not a neurologist or a neurosurgeon.
No.
So then you went. So he doesn't really know.
Right.
Not to discredit a podiatrist, but they're not.
Sure.
They're not nervous system physicians.
Correct.
With your neurologist, two neurologists and one neurosurgeon, did they give you any hope? Did they give you medication? Did they give you any insight as to what could develop here, or if there's any way of getting better?
I'm gonna say no. They were more. The atmosphere, the feel that we got from them was more like it's over. Let's go ahead and start preparing for the end. Mm-hmm. And this kind of thing is defeating. However, we wanted answers. Mm-hmm. We wanted to know what is it that we can do to improve her quality of life. Mm-hmm. Where did this actually come from? Mm-hmm. Is it something that we're doing that we can reverse? Or is it something that we weren't getting clear answers. Mm-hmm. As far as where it was coming from.
But they did give you a medication?
For the ALS, yes, I just chose not to.
Okay, and you also, so you didn't take that medicine, but they gave you a steroid as well?
Yes.
And
yes.
did you feel
That was
any...
before the diagnosis.
Before the diagnosis, did you feel any improvement?
No, I kept getting worse.
Kept getting worse, and you put on some weight with the steroid.
Right.
And prior to the diagnosis, you, as the foot drop was obviously very obvious to you, you went for physical therapy,
Yes.
and they tried some exercises or stretching or so on, and was there any improvement?
No.
So now
This was all coming under the assumption that there was a herniated disc,
herniated disc, okay.
Right.
which I do have, but it's not. It wasn't the.
It's not going to cause a foot drop.
No.
And it's not going to cause a bilateral, both ankle foot drop.
No.
Yeah. So so you found me, and I gave you a bit more insight of different infections and chemicals that could be causing the destruction of your nervous system.
Correct.
So
Correct.
so in April 28th we started. Well, beginning of May you really started your first protocol, and so let's just go through, if you could, some of the symptoms that you've had and what you've seen, the changes with the positive changes. And we're talking about this is positive news, right?
Right. Correct. This is positive.
Yeah. So
In terms of positive improvement, for one, my wife's feet, her ankles were very swelled initially, but they started decreasing, returning to normal. That was the first thing we saw within a week's time.
within a week of taking
With a
the
week,
remedy.
yeah, just taking the remedies, and in a week's time we saw a difference.
Amazing. And how much of a decrease do you think now compared to what it was prior to coming to me?
Oh, at least 80% increase of improvement.
Of 80% of a decrease of the swelling around the
Correct.
feet and ankles.
Yes,
Okay.
yes.
So that's improved. She also had fasciculations in the thighs and the legs.
And that was our main driving force as to trying to find you and find a solution, because this fasciculations, which most ALS patients can understand, it's torture, not just as the patient but also as the caregiver, and the fasciculations, what it would do would just basically keep her from getting comfortable, from actually getting sleep. But after taking the protocol, man, in a matter of a few weeks, it's gone. Correct? I mean, it was basically to nothing.
Nothing.
Yeah.
No fasciculations.
No, none.
How many weeks would you say now you have had zero fasciculations?
I think the last time she had fasciculations was maybe 3 weeks ago. That might have been for like 10 minutes.
For 10 minutes.
If that.
And how often were the How long did you have fasciculations for before you came to my clinic?
Oh, they were every day.
And how many months were you experiencing them?
At least 4 or 5 months.
Yeah.
4 or 5 months every night. There were sleepless nights. Waking up every 10 minutes, trying to massage and trying to alleviate the pain, just enough for 10 minutes for it to come back. It was very frustrating.
Very frustrating and pretty scary too.
Right.
Because it's like, why is my body doing this?
Right.
And did you see any neurologist or any other physician or surgeon, anybody at that time with the fasciculations that you had for those 4 or 5 months every day? Did you see anybody who gave you any kind of insight of what to do to reduce them?
We did see a doctor at a particular hospital. He was a neurologist, and we did address about the fasciculations. He prescribed us basically a leave. And
that was it.
That was it. That was his
no
answer to that. And basically, I think that his actual words were, "There's really nothing we can do about that. That's just part of the disease."
And it didn't do nothing.
It didn't do anything.
The
No.
Aleve did nothing.
No.
His advice did nothing, Aleve did nothing, and it just kept progressing and getting worse and keeping you up all night.
Right.
Yeah.
How many months were you not able to sleep for? Barely sleeping, if you will.
Months.
Months.
At least 3-4 months.
How many weeks are you able to sleep a full night now?
Oh wow.
I'd say about a full night. I'd say about maybe twice a week, but the rest of the nights I'm sleeping better.
How much better would you say?
I was sleeping maybe 2 to 3 hours a night.
Yeah.
Now it's
like
maybe
8 hours,
5,
5,
6.
6 hours, yeah.
On a good night is 7,
great.
8.
Yeah, she'll wake up maybe for a bathroom break, but it's not like before. She'll
It's
wake
not
up because of
the
pain.
It's not because of the pain.
Yeah, it's because of bathroom break, which is
So
fine.
fasciculations have been totally gone for about 3 weeks right
Yeah,
now, and
yes.
they were reducing in their frequency and their severity.
Correct.
For how long before they completely stopped right now?
I would say reducing the last 2 weeks. They're completely gone for the last 2 weeks, but before that, it was decreasing in a month's time.
A month, you notice a decrease
Yeah,
in severity
in a
and
month's time.
frequency.
Yes.
Excellent. There was also, you had a rib cage pain
Right.
that was constant, and that's
That's gone.
Totally gone. How many weeks has it been gone for?
It's a month.
Yeah.
About a month.
About a month. You were only going to the bathroom for number 2 to relieve your colon one time every day?
About, yeah.
And now you're going
About 2 to 3.
2 to 3 times a day,
Yes.
which is better because you're relieving, you're actually moving the body.
Right.
You're moving, removing the
Toxins.
toxins through that channel. You also told me, and this was, you said your family has been saying that she looks
Yeah, vibrant.
vibrant.
And healthy. I see her every day, so, and I'm with her all the time, so I didn't see it, but her family would come by to visit her, and they would say that she looked a lot more healthy, a lot more vibrant, more happy. Her
And these
color
are
looked
people-
better.
And these are people who are just trying to placate her to say,
No.
we just want to make her feel better.
No. They're
No, because they were telling him in private. They weren't saying it
that
to
too.
me.
Yeah, and they're very straight up people. They're not sugarcoated people.
They're not going to do that.
They would tell me the truth. Yeah.
So right now, do you have a bit more hope, both of you? Do you have a bit more hope that there's a possibility to A, stop it from regressing, and B, possibly reverse it?
Yes.
Absolutely, yeah, absolutely. We just, we came in with the intention of making her life more comfortable, and we're so happy that that's happening. It just gives us a more peace of mind to actually understand what it is that she's going through, and we should be up to you, Dr. Herman.
Thank you.
Thank
I
you.
appreciate it. So there is a chance for you to help yourself slow down, if not even stop the progression of this horrible, life-threatening illness. I practice a very unique process where I can help you stimulate blood vessels in your brain to help them dilate and bring better blood flow with oxygen to the brain tissues to reduce the fasciculations and stop the fasciculations and get rid of the infections and chemicals that are in there. You can go to my website. I'll put it on the bottom of this video. You'll see the website link. And I look forward to helping you give yourself or a family member a chance. And real people, you're real people.
Real people.
This is real.
This is it.
And they both have more hope, and the family has more hope that she's making it, and this is amazing. I look forward to helping you too. Thank you guys for coming in.
Thank you,
Thank you
Dr.
for helping
Herman.
us, Doctor.